Well, hello everybody. Hello everybody.
Hello,
Welcome
how
back to
are
another
you?
episode of To a Woman's Heart, where we uplift, motivate, encourage, and empower women. And tonight is Tuesday, where we're highlighting women in business and pushing women forward. So tonight we have Constance Sullivan with us again, because the last time she was with us, we was talking about Medicare, Medicaid. But tonight we're going to be talking about preventive services, what's going to be opening up in the Austin community for seniors. So, Connie, introduce yourself to everybody and tell them what you've been up to.
Hi, everybody. My name is Constance Sullivan, and everybody calls me Connie. And I've been working very hard to open up a resource center, I guess you would say, or a place for seniors and people with disabilities to come during the day where they can learn different activities. Um, if they need mental health or medical services, we are in place to help them to receive these services.
Okay. And what kind of services will they be receiving?
Um, they'll have a nurse monitoring service where the nurse can monitor their blood pressure if they have hypertension, if they have diabetes, can take their diabetic level. Teach them about both of those diseases, which we know that most of the time is controlled by your diet.
Mm-hmm.
Also, physical therapy, mental health counseling, group sessions, um, foot doctor, podiatrist,
Mm-hmm.
also any kind of services that can be done on premises will be offered to the seniors. A lot of
Okay. So how?
resources. We're going to try to put together some job opportunities, all of that for
Okay.
the seniors.
So, how would people be able to be a part of preventive services, the programming that you're going to be offering?
Well, all you have to do, well, you have to qualify. You have to have Medicare or Medicaid, or both. Also, you can just call in at 312-730-8279. That's 312-730-8279. Ask for Connie. I'll be answering the phone, and I can let you know exactly when the program will start. Also, if you need in-home services, now I can help you to receive those services as well.
Okay, what's the phone number again?
312-730-8279.
Okay,
Okay.
all right.
I see it going
So,
across the screen. Fancy.
so
Fancy.
just in case somebody don't remember the number, they didn't catch it, it's at the bottom of the screen. This is important because there is a lot of seniors out here who needs the assistance and they need the services, and they're not aware that they can receive these services in their communities. And as we all know, our community suffers the most
Absolutely.
because we don't get the required services that we need in our community. So this is a good opportunity. So can you tell everybody where the programming and the services will take place?
The programming will, well, first I want to give a shout out to True Love Church, where I'm a member, who has opened their doors up to us to have these services, and Pastor
Mm-hmm.
Terrence Keys and Bishop Willie Sullivan. We thank them very much for allowing us to come into the church and get things started. But the
Mm-hmm.
services, but the program will be at 105 North Laramie. That's right at Laramie and Washington, one door off the corner. It's called True Love Church, and it's at 105 North Laramie. That's Laramie and Washington Boulevard.
Okay. And do you have a time frame for these services?
Well, once we get the services started, the services will probably be from like 10 to 2, a couple of days
Mm-hmm.
a week. We haven't we haven't laid out all the program yet. One of our members is not feeling well right now, and we're praying for her, Sister Barker. We want to let you know that we're praying for you. But as soon as things will be, the next time I come on the show, I have the whole outline for
Mm-hmm.
you. Um, but we are putting things together. We are with close contact with our licensed professionals for this program. And everybody's
Mm-hmm.
excited, and we're really ready to serve the community. And it's
Mm-hmm.
much needed.
Okay, so when you say licensed professionals, what do that consist of? So everybody can know that it's not just a program that's being just tossed together.
Oh,
It's actually
absolutely
being
not.
structured properly.
Absolutely not. We have a licensed psychologist on our staff, a licensed LCPC. Um, we also have two licensed medical professional doctors on our staff. We have nurses, physical therapists, podiatry, podiatrists, whatever services that we have. Everyone credentials have been fully investigated and checked out, and they are legit. And when we say licensed professionals, we mean that they have their license, they're practicing, and they're providing good service.
Okay, so everybody can understand it's just not something, that's being placed in the community just to sit and occupy a spot.
No,
These services are there to be beneficial to those in the community who need these services. And a
absolutely.
lot of information we don't receive, like I said, and a lot of services we don't get. So we're trying to make sure that you are aware that there is something that's sitting locally that you can share with those elders in your family because they will need them.
Absolutely. But not only that, we also help to, as I said before, to get services in the home. We help with caretakers and other services that's needed in the home, like if they need a shower chair or a bedside commode or a hospital bed in the home. We also help with those issues too. We also help with HMO disenrollment because we know that you can pick up the phone and they can tell you, we're going to help you save medicine. And the moment that you say yes, you are in an HMO. So we also help people to get out of the HMOs. And I try to tell the seniors and the people with disabilities that I'm in communication with of the warning signs of these calls.
Hmm. So what is so let's dive a little bit deeper because a lot of people really don't understand insurance like they say they do because they believe what people tell them, and even those who in the field not all they don't always look out for your best interest, and a lot of it is based on financial reasons why they do what they do. So
Absolutely.
uh, the platform is to educate so we can understand that we have better options and we don't have to feel like we're boxed in our options that we are being provided. So I want you to explain a little bit the difference between the HMO and the PPO because people don't understand the difference between these different insurances. They think HMO is a great insurance, and to a certain extent, HMO is a good insurance, but it has so many restrictions that people are very much so unaware of.
Okay, well, HMO is like managed care. So if you ever had a Medicaid card, that's basically what HMO is. You have to go to a certain doctor, certain hospital. You have to get a referral to go from here to there. If you're young and healthy, HMO might work for you. But if you're
Mm-hmm.
not young and healthy, you want to be able to go to any doctor, any hospital that you want to go to. uh, uh, Receive any services you want to receive in home, out of home, whatever. That's why you don't want to get into an HMO. You want to utilize the PPOs of Medicare, and if you have Medicaid, you want to do straight Medicare with Medicaid and your Part D plan. You don't want to use managed care because it is what it is, managed care. So that
Mm-hmm.
means that the doctors on HMOs that works for HMOs, they get paid a salary. and they have limited tests they could run. Like they say for this one particular illness, there might be 6 tests that the HMO allow the doctor to test on. And they would have to follow this format, as opposing to having a doctor that works with Medicare and the PPOs. There might be 10 official tests that goes with this, what's wrong with you. They're going to do all of them because they're getting paid per service. So that's what makes a difference in your health care, a managed care versus PPO or straight Medicare, because they're going to do everything. And managed care has restrictions, and the doctors are paid by the hour. So they just want to go do their 9 to 5 and come home. When doctors that's not in HMOs, they seem to they do more. They do additional tests. They get down to what the core of the problem is. And with an HMO, the doctor hand is limited. He has to go by the format of the HMO.
Okay. So when I've listened to you talking, to me, that managed care, like if you have something seriously wrong, they're only going to go so far because they're restricted in how far they can go. And to get the best diagnosis, the best result, and the best end result, PPO seems like the route to go.
Absolutely. PPO, like I said, or you can go to straight Medicare AB and get your Part D plan. That is definitely the way to go, because you want to get the best quality service that you can get, and you want to be able to go wherever you want to go. I don't want to be restricted to a particular hospital because that insurance is an HMO and that hospital is linked to that HMO. I want to be able to go anywhere and not get turned around because they don't take the insurance.
Right. And then for when I think about going to any hospital, I always connect your mental and your physical go together when you're sick. So if I'm in a hospital I'm uncomfortable with, then I'm not gonna, my body is not gonna respond because I'm not comfortable in the facility that I'm in. So the options that you can pick the hospital you want to go to, because there's certain hospitals on the west side I would dare not go to. Don't take me to the door. Don't pull up in the driveway. I'm not going. I'm not. So, and that would mentally affect my healing process, because if you put me in that facility, I'm not happy. I'm not happy. I'm stressed, because I don't, I've heard the horror stories. I feel like I'm not going to get the best service. And so physically, I can't get what I need because I'm not happy in that hospital. So to know that you have an option where you can choose an insurance plan that will give you the freedom to choose what hospital you want to go to, that makes a world of difference.
It makes a world of difference, because you don't want to be trapped, being, in one place where you could have went someplace else and got a specialist without waiting 3 weeks from a referral from the HMO. You can just say, okay, I'm gonna go see this doctor and see what they have. I want a second opinion. And you could just walk into the office, versus you have to get a referral. You got to wait until they reply to each other, and then somebody has to contact you, and it's a lot.
Yeah, and whether we know it or not, time makes a world of difference.
And then also, wherever you want to go, after you get the referral, you have to make sure that they take that insurance.
Exactly. They're in the network.
They won't take you. They have to, right.
They're in the network, as it says on your insurance plan papers. It's either in network or out of network. And if you can't follow the doctors in the network and you decide to go out of network, you also need to know there's additional costs for stepping outside the network.
And that's also true. That's also true with the PPOs, but they're not as expensive as the HMOs. But there are some PPOs that have in and out of network benefits as well, but they're not restricted to certain places. So that's another difference. And like I said, when you set up your insurance, it's all based on your needs. So if you're a person that's sick a lot, You want to get into a very good PPO or go to straight Medicare. If you're a
Mm-hmm.
person that's not sick a lot, then you can go either way. But you don't want to go into an HMO and get restricted care. That's
Right.
what you don't want to do. I wish they can just throw them all out the window. And a lot of times when they put the seniors in these HMOs, the person that's putting them in the HMO, they get paid by the HMO. So they're gonna say whatever they need to say to you. They're gonna tell you they're gonna save you money on your prescriptions. They're gonna bring you a box of chocolate, whatever. But they're getting like $300 for putting you in that HMO.
And you still end up spending a lot of money out of pocket because
But you
prescriptions.
can't do nothing with it if your doctor when you go to your doctor the next month and they tell you we don't take HMOs.
Right. Yeah, prescription costs a lot. I know I went to get an inhaler for my asthma, and the lady told me the inhaler that I needed cost $180, and I was like, "What?" That's a lot of money. So I don't think people realize when you talk about insurance, you have to think about those prescriptions as well that you're going to
Absolutely.
need when you're getting your insurance plans, and we don't connect the dots on that.
Absolutely. Absolutely. So there's part A, part B, and part D that will cover you. If you got public aid, that'll cover you even more. That'll take away those co-payments on your medication and the hundred and something dollars that you have to pay for the part B plan. And a
Hmm.
lot of people will get the A and won't get the B, but the B is so vital. The B pays for all your in-home services when you go stay in the hospital, everything. The B pays for a lot, so you have to pay for your B. And they have to remember that once a year, there is a deductible for anybody that has Medicare of $185. So at the beginning of the year, you might go to the doctor and the doctor say you have a deductible. That is true. Until you meet that $185, when you go to the doctor, you might pay $5, you might pay $10, and some doctors don't charge you anything. But
Hmm.
every senior, everybody that has Medicare has a deductible at the beginning of the year of $185.
Okay. See, I didn't know that. So here's another question. If I'm in Illinois and I have my PPO Medicare, so if I get sick in Arizona, I still can go to the hospital, correct?
Yes, as long as it's Medicare.
Okay.
Yeah, but if you're in the HMO, you can't.
Okay. See, that's what I want to make the point because a lot of
In the
people
HMO,
think,
you can't. Now, now,
yeah.
if now if you have Medicare Part A, Medicare Part B, and Part D, and some kind of supplement or public aid, you can go anywhere. When I say anywhere, I mean anywhere.
Hmm.
That's
So
perfectly assured.
it's important for everybody to know your rights as it relates to your insurance because some companies will tell you they don't take it and they do take it. They should take it. So this is important information for us to absorb so we can know. So here is another question that I had with one of my relatives. Uh, if a senior has worked a job for say 40 or 50 years and then they leave that job because they have good insurance does not mean they don't qualify for Medicare or Medicaid, correct?
Correct. That's
Because
correct.
the thinking was, the thought process was that they didn't
That's
need.
if they're taking, like some jobs, like say if you've been a school teacher for
Mm.
40, 50 years, they don't take Medicare out, so they don't qualify for Medicare.
Oh, really?
So if your check stub got that what is it? Illinois MEC, I believe on it. That's Medicare is coming. You pay for Medicare before you receive it. You have to have points. You have to have worked a job, or you have to be a relative. I mean, immediate relative, like son, daughter, something like that. That close
Mm-hmm.
relative to be a C1 to receive someone else's Medicare that is taking care of you, and you are blood relationship. I mean, as far as mother, child, daughter,
Mm-hmm.
it has to be that close. It can't be. I can't give my cousin my Medicare. I can give my child or my husband my Medicare. You
Oh,
know,
really?
yeah. If they get disabled, yeah.
Mm-hmm.
Hmm.
So is there an extra cost for that?
No,
So
no.
it's all
Okay.
included.
So let me explain that a little deeper. Say
Mm-hmm.
that I was receiving Medicare benefits and I had
Mm-hmm.
a child, and
Mm-hmm.
whatever was wrong with me, it got passed on to the child. The
Mm-hmm.
child would automatically receive Medicare benefits.
Really?
Yes.
Okay, so I'm gonna use myself for an example because I can use me.
Okay.
So when I was pregnant with my son, who's now deceased, um, I had issues during my pregnancy. Now I don't know if those issues pushed over to my son. So with him being born with these issues, that means that he was able to receive Medicare
He
from
was
me.
able to, because you have Medicare, they would give the child Medicare too, but the child will be categorized as disabled if you are categorized as disabled.
Okay. But only if I'm categorized as disabled will a child be able to get it.
No, if the child come out disabled and you're
Hmm.
healthy, the child can still get disability. And most of the time that is Medicare or
Hmm.
Medicaid. It depends on
Hmm.
what the parent applies for. You apply for a child, I would apply for Medicare.
Okay.
I would apply for public aid. I would want the best insurance I could get for that child.
Hmm. Yeah. I mean, he was taken care of, but yeah. So I was using myself for the example so people can understand because sometimes people hear and they be like, I get, but I don't really quite get it. Really don't make sense to me.
And
So,
and premature babies qualify for Medicare. I think up to age 8.
oh, really?
So if you have a preemie, you can apply for Medicare for that
No.
baby. Yep,
Okay. I didn't know that. That's good to know. And this information is so important because we walk around and we listen to people feed things into us without checking and validating if it's legitimate and true. And so hence why we do what we do to make sure that you understand there are options out there for your grandmothers, for your great aunts, for your mothers, or whatever it may be. And this information, we should take it and use it and share it with somebody because there is
absolutely,
somebody out there that don't have a clue.
absolutely. And being in the field, you always run into people that have Medicare and don't know what to do with it. I mean,
Hmm.
believe it or not, it's a lot of people that don't know what to do with it. There are still seniors who are over the age of 65 who has not called Social Security and got their Medicare and their Social Security benefits.
Really?
Yes, it is. I do it a lot. I help people to call Social Security and get things started. Because a lot of people don't know what to do. They know that they have these benefits at 65, but they don't know how to get them
Why is that, you think?
because the information is not out there.
Hmm.
So it's people like you, Renee, that help the community to know about these things.
Hmm. And so it also this also should provide some insight for family members to take up the charge to check on their elders and make
Absolutely.
sure they're getting the services that they need.
Absolutely. It takes the family to also to help, especially if there's some dementia or Alzheimer's involved. And not just for our seniors, we need our families to step back up to the plate to help raise these children to stop shooting each other. This is no way for people to live. I mean, you shouldn't be afraid that you might have to duck a bullet when you go outside. If we can go in other communities and feel safe, we should be able to become in our community and feel safe. No, we're not animals, and we shouldn't be out here shooting and killing each other in that fashion. Whatever situation it is, it can be worked out without somebody dying.
Exactly. I agree 100%. And my heart goes out to what we're dealing with today. It is
Absolutely.
heartbreaking. It's
We just
heartbreaking.
lost another child. It's
7 years old.
it's time to put the guns down. Whatever y'all, these people out here is whatever y'all arguing over. You know what I'm saying? It's not worth taking a child.
Yeah,
And the turf and the territory, it don't belong to you anyway. So it belongs
exactly.
to the city of Chicago. So
Exactly. Exactly.
so
I agree.
what battle are you really fighting?
Right. And then
What
and it's bad because our seniors are so fearful. You know, they should not live out their lives. They didn't put their time in, and they should be comfortable. They should be able to walk the streets. They should be able to be taken care of, get the proper medical attention, proper
absolutely.
prescriptions, proper services, whatever they have put their time. And it's our job as the younger individuals to make sure that that wisdom they walking around with is taken care of. And
That's
we're
right.
not doing a good job in taking care of that wisdom that walk around. We're not doing a good job.
That's right.
I've seen seniors struggling with groceries. I've seen seniors standing in line trying to get a prescription and can barely stand up. And I'm saying, where is the child if they have children? Where is the cousin, the niece, the nephew, somebody, the grandchild? Where are they?
We have to get back to the fundamentals of the families and start killing our families and start taking care of each other correctly. All this stuff out here, it's not even worth it. And the ones that are out here that's doing this, it's not even worth it to them. You know, you promised 3 scores and 10, and you out here doing this wild stuff, and you're dying at 20, 16, 17. You haven't even tasted life. And you have to
Right.
ask yourself a question. If this fast life worth it? You know, and the sorrow that you put your family through, we have to start turning the thinking of our youth around whatever way
Mm-hmm.
we can. We got to get some things going in the community for them so
Mm-hmm.
they can take this energy and put it in a different place. You know,
Mm-hmm.
it's just, it really hardens my heart that our communities are so not bonded together. Let me say that.
Mm-hmm.
I remember when I was a child that the families were really close, and if you was doing something, the neighbor could come out and tell you to stop. Nowadays, if the neighbor come out and tell you to stop, the mother want to fight. I don't get it. I mean, you want your child to be safe, so everybody has to help. Everybody has to help build the communities. Everybody has to help with our children. It you can't you can't build a community yourself. Like what is that saying? It takes a
A
village.
village.
Yeah, it really does. It
Yeah, it
really does.
does.
It
It
really does.
does. It does. And in order to get old, hey, you gotta do right. You
You
gotta
got
do
to.
right.
You
You
got
want
to.
to live to be older, and you're laughing at these seniors and all this stuff, and you're disrespectful in front of them and everything. But the tables are going to turn. If you don't die young, you're going to be in their shoes one day, and you're going to need the same thing that they need right now. And it's so much
Absolutely.
elder abuse that's going on
Absolutely.
that it's ridiculous and it's heartbreaking. It's so heartbreaking.
It
And
is. It
and a
is.
few people that's stepping up to the plate, it can't be a few. We all have to play a part in changing the narrative of how our communities are looked at, how we are treated, and how we treat one another.
Absolutely. 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 And it's just so important that start changing the way we think, you know,
Mm-hmm.
the way we teach our children to
Mm-hmm.
think when it comes to violence, you know,
Mm-hmm.
and what's going on in our communities. You know,
Mm-hmm.
when I was coming up, and kind of the same things was going on, but I was the type of parent that would walk out there to the drug dealers and tell them, "Don't give my son nothing, because
Mm-hmm.
he's going to deal with me."
Mm-hmm.
And parents gonna have to step up and put their arms around their children and do whatever they can to help keep them safe. And at the same time, we got to start teaching our children that playing with guns is no joke. And
Yeah,
they're
but
starting off really young, training these children how to be violent. And we have to
mm-hmm.
step up as parents, start paying attention.
Mm-hmm. Exactly. Take our households back.
start paying attention. Get
Yeah.
your head out the TV and out that phone and start
Hmm.
paying attention.
Right.
That's what we got.
Yeah. Exactly.
To do.
Exactly. Exactly. So I hope that all who have listened tonight, even though we diverted a little bit, it's okay.
We was all
Sometimes, sometimes you need a little diversion because
yeah,
somebody may have needed to hear that, so we can change
absolutely.
some things. And I just say this: our communities are looked at not good. We don't. They don't look at our communities as good. They don't look at our communities as thriving. They don't look at our communities as pouring programming or services in our community. They just don't. And I think some of that is because we don't care about our own communities. We just don't. And I'm not saying this lump everybody in the bucket, because there are a small percentage that do, but there's a nice large percentage that do not care about our community
Absolutely.
until something tragically happens. And then everybody want to come from out the woodwork like roaches when you cut off the lights. So we need to
Yeah, but you're right though. You're right though. While we're on, I want to give a shout out to Rosemary Langley, and she's watching the broadcast, and she's an advocate for the South Side of Chicago, and I just
okay.
wanted to tell her hi and thanks for tuning in to A Woman's Heart, and it's on every Thursday, Miss Langley. So tell somebody about it.
Every Tuesday. And
Every
if you
Tuesday, I'm sorry. Tell somebody about it. She'll get
and
the
if you
word out.
right. And if you have somebody that's in a woman that's in business that we need to highlight, just let us know, because that's what this platform is for. We have a lot of women that work diligently in the field. And it's not for to place them and make them more than what they are, but we need to know that these individuals exist. And a lot of time, a lot of women do a lot of things that people don't even have a clue.
Don't have
And
a
they
clue.
could typically be your next door neighbor, and you won't know
Absolutely.
that they're doing great things, but you'll know when something tragic that they're doing happen. How not balanced is that? You'll
Right.
highlight the tragic, but you won't highlight the good things that an individual does. And that's what I'm trying to do, to make sure that people are made aware that these strong women exist. Because it takes a strong woman to do a business, to take care of household, take care of kids, grocery shop, and all kinds of stuff.
Absolutely. Absolutely.
That's a strong woman, and to keep her sanity in the process.
Absolutely.
You hear
And
what
I'm
I'm
and
saying?
I'm sure a lot of women are saying absolutely with me.
Right. But we don't get the accolades for it. And it's not um to make you feel like you more than you, but you need to know that you're appreciated for what you do.
That's
And
right.
that's what this platform is about, is letting you know that we appreciate you. And then for those who sit and they see things going on, like they got this building over here and they doing that, people come in and out, I don't know what's going on. You're not trying to find out what's going on neither,
Yep.
because everything is not
You have to
drug
get nosy.
activity.
That's right. You
It's
have to
not.
get a little nosy.
Hmm. A
You
lot of
gotta
things is beneficial for you, and you miss those benefits because you don't ask the proper questions. And things that could have helped you and your family move along a little bit further. But we so closed mouth when it comes to things that we should open our mouth for. And we open our mouth for things we should close our mouth for.
Absolutely. I totally agree. I totally agree.
So
So it's time to make a change, and
it's time.
it's gonna start with us. It's gonna start with us. It's gonna start with our families. It's gonna start with our household, and we have to start teaching something different. Uh,
Mm-hmm.
a lot of times people don't move forward because they hold themselves back. So
Mm-hmm.
we have to start thinking differently. Like I said, training our children differently. We need to focus on getting good educations, making
Mm-hmm.
sure our children get good educations, get good jobs. You know,
Mm-hmm.
stop hanging on the corner.
Mm-hmm.
Everybody has a home. You have a backyard. You have a place to. You You don't have to be standing on the corner doing what you're doing. And,
Exactly.
right. Okay, you might make a couple of dollars, but then your life is short, or your life is taken, or your life is confined. So
Mm-hmm.
is it worth it? And we need to talk to our young men, and so we can get our strength back in our neighborhoods,
Mm-hmm.
get our men back on track.
You're right. But
Is
some
it
of our older men need to step up and show them how to be men.
absolutely back in the day they used to cuff the younger guys and talk to them, teach them the way, and they wasn't afraid of them, and it's a whole nother thing nowadays.
Yeah.
So we just got to get back to the basics. We
Yeah.
got
And
to
it's so
save our we
easy.
got to save our community. I don't know if people are sitting back waiting for the community to save itself, or somebody to come in and save it. No, we got to roll up our sleeves and save our own communities.
Exactly. And stop pointing fingers because we all are accountable.
My dad teaches us in church that when you point your finger, so you
You
got that
go.
one finger pointing at
Uh-huh.
you, but the,
Forward
the
point.
one, the other four is pointing back at you. So
Exactly.
don't point
So
your finger, and the other
we have
pointing up
no
at
room.
God, because God knows.
We have no room. We have no
We
room.
don't have
And
no
I
room to
no
point.
room whatsoever. So we need to be cautious and careful of that. And don't do nothing to nobody you will not want anyone to do to you.
Absolutely.
Bottom
And
line.
I just want to compliment you, Ms. Thomas. You are doing a great job at getting the word out to our communities. And I had the last time I was on your show, I had a lot of people to text me and call me to tell me how much they enjoyed it, and they didn't know about To a Woman's Heart, and they would start tuning in on Tuesdays.
Hmm.
But just having someone like yourself, a creator and a visionary of what needs to be out in our community, and then you're willing to take the time out to help spread the word, I admire you, and I just wanted to tell you to keep up the good work.
Thank you. Thank you. Thank you. Thank you. I want to make a plea for younger individuals because I know there are some young entrepreneurs out there, and I want you to come forth as well. This is the time, this is your season. We want to acknowledge you so we don't have to stay, in the older range. We want to acknowledge every woman that's doing a business. It's no discrimination, not about color, not about the size, not about none of that. If you are making an impact where you are standing at right now, then we need to know where you're located. And so I'm
All
saying to you, whoever is listening on this live stream or even on replay, send me an email at number to a woman's heart at gmail.com and let us pull you forward so we can push you forward so people can know that you are in existence, and let no fear stop you from doing what God has called you to do. And that's
right.
all I got to say.
Okay. A wonderful evening. You're such an inspiration. Have a wonderful evening, and may God bless you.
Thank you. Same to you. All right,
Okay.
everybody. That concludes another episode of To a Woman's Heart, where we uplift, motivate, encourage, and empower women. All right. So we'll be talking to you tomorrow on Wednesday Nuggets. Tomorrow, Wednesday Nuggets. So tune in at 7:30. All right. Till we talk again. Have a good one.